So just a brief lecture about the anatomy of the stomach. The stomach occupies the left upper quadrant, the epigastric region, the umbilical region. Most of it is covered by the ribs. It's located between T10 and L3 in the vertebral position, but obviously it varies from person to person. It's mainly divided into four regions: the cardia, which surrounds the esophagus as it enters into the stomach, the fundus, which is the most superior aspect of it, and the body itself. And then that goes into the pylorus, where the pyloric sphincter is, and then that marks the end of the stomach and the start of the duodenum, which is the first part of the small intestine. So there's two important sphincters to think about, and that's the lower esophageal sphincter, which is at the border between the esophagus and the cardia, and that's also aided by the angle of His, which is the angle in which the esophagus penetrates through the diaphragm at T10 and prevents reflux. And then there's a pyloric sphincter, which is just at the end of the pyloric canal, which marks the end of the stomach and into the first part of the duodenum. So there's two curves to the stomach. There's the lesser curvature and the greater curvature. The lesser curvature is the inner bit of the C, and that's where the lesser omentum will be attaching on, and you need to pierce through that if you're ever going to do any gastric banding, which is a common question that seems to come up. So the blood supply is off the celiac axis, or the celiac trunk, as it's sometimes referred to, and that's at T12, and this is one of the first unpaired artery that comes off of the aorta. So there's a celiac trunk at T12. Just immediately below that is the SMA, superior mesenteric artery, and then below that is the inferior mesenteric artery. So the celiac trunk itself has got three branches coming off of it: the left gastric artery, which will supply the lesser curvature and all the way up to the lower bit of the esophagus. Then you have the splenic artery, which comes behind the stomach, posterior to the stomach, gives off some branches to the pancreas and then to the spleen, and then gives off these short gastric arteries, which supply the greater curvature of the stomach, and the left gastroepiploic artery, which again is the greater curvature of the stomach. And then finally the hepatic, or the common hepatic artery, that comes off as well. That obviously supplies mainly the liver, but gives off a gastroduodenal artery, and that goes posterior to the duodenum and then gives off a branch to the right gastric epiploic artery, which again supplies the greater curvature. The gastroduodenal artery is an important EMQ part of a staple diet, because if you have a posterior duodenal ulcer that erodes through, that's going to be your artery that's going to cause copious amounts of bleeding if it's damaged. So the arterial supply, just so we have it written out, is the celiac trunk, which comes from T12. The left gastric supplies the cardia and the esophagus, and the lesser curvature of the stomach. The splenic artery, which gives off this less gastroepiploic, and the short gastric arteries, which have got very poor collateral supply. And the hepatic, which gives off the right gastric, and the right gastroepiploic arteries, which give off branches to the greater curvature of the stomach. The venous drainage is really as follows: the arterial, and the left gastric is important to note. Like most of the veins in the stomach go to the portal vein. And if you have portal hypertension, this is going to dilate. As this dilates, it supplies the lower end of the esophagus, and that's going to cause portosystemic shunt to the azygos vein, and that's going to eventually can cause you esophageal varices and catastrophic bleeding through that. The nerve supply to the stomach, the parasympathetic, makes up the majority of it, and that's supplied by the left and right vagus nerves, and the sympathetic supply comes off the splanchnic nerve, or splanchnic nerve roots, which is the T5 to T10 spinal segments.